Hey, happy Friday, everyone. This is Blake Hotchkiss, Clinical Education Specialist with the Association for Vascular Access. And we're talking Ivy League learning. So, joining with me today is Andy Rellihan, the EVP for Nexus Medical, and he's going to be presenting next week. So, hey, Andy, how's it going?
Hey, how are you? Happy to be here.
Great. So, tell the audience a little bit about yourself.
Sure. I spent 14 years in healthcare technology, more specifically, the EMR world. So, a lot of my background is in how do you implement, sell, work with clinicians on workflow, all related to technology that was rapidly implemented and adopted over the last 10 to 15 years. That was the majority of my time, and then I moved on as this kind of buzzword in healthcare started 5 or 6 years ago around big data and big data analytics. I started working with health systems around population health and value-based care initiatives and using all of the data they have to go drive outcomes and using data to go make decisions around patients with diabetes and heart failure and multiple chronic diseases that are going all over the place. That's my background, and I kind of took a left turn to come to Nexus, but I was really interested in how do we go take those concepts and apply them to vascular access, and that's what I've spent the last few years doing. Is how do we go take the approach of using data, using information to make it easier for the vascular access specialist, and make it easier for those in vascular access to um, not only look at information to drive decisions, but to make it easier to just do their job every day. Um, so
And
that's what we're up to.
yes, and next week you're going to be presenting on Ivy League learning. This is Ava's micro learning sessions, so it's something new that we introduced this year. Our director of clinical education, Judy Thompson, has definitely done a great job of collecting some awesome speakers to come to this, and it's just meant to be like just little bits of information for our student members that have come on board with the PIV curriculum, the fundamentals of IV therapy course that we offer or give to universities for free in partnership with B. Braun. Really trying to attract the students before they hit clinical practice and giving them best practice advice, really, how to train them in IV therapy and in these standards of care. And then out of that, what was born, the day-to-day operations of AVA is really these educational events that can help connect maybe newer people in the vascular access space, maybe some of our people who've been around a little while just want to get caught up real quick with a nice little informational session. And they're free to attend, which is fantastic. And we've been covering
Yeah.
topics from blood culture, with DJ Shannon that we interviewed on Facebook Live before. Several other great speakers that we've had on. And then, Andy, you're going to be talking next week, and you're really helping the audience understand a little bit more about using big data. Are there any other little teasers you want to tell our audience about your presentation next week?
Yeah. It's like it's one of those things that it's such a broad and vague topic, or it can be. And what we really want to distill down is how do you use the information to make an impact? It's one thing to just have a dashboard or some screens, right? But it's another thing that how do we couple it with better process? How do we couple it with better protocols that we can then look at to go drive? Well, what was the impact that those had? And how do we use that to then educate our administrators, educate those throughout the health systems to use that information towards doing what's right for the patient? And that's really what it all comes down to, is doing what's right for the patient. And what I've seen throughout my career in the past is oftentimes those that build the technology and those that build these systems didn't always do it with the nurse, the physician, the therapist in mind, and we're burdening them with clicks, with tons of time to go sift through lots of information. And the quest to do that and the quest to make it easy continues. And we're now at a post-COVID time where we've got to make it easier, and we've got to make it easier for nurses to do the right thing. And technology can be an enabler. And we're going to talk through how we go put those things together, put those components together so that we can make it easier for the vascular access specialist. Because as I've stepped into my new role, what I've seen is so often the vascular access specialist and the nuance that goes into vascular access care, insertion plus care and maintenance, is left behind. And we want to help bring an impact to that in terms of how we can help solve that problem using information.
Yeah. And it's funny. It's this big sea of data that we collect.
Oh,
You think of any patient chart you as a clinician interact with, how much information that you're putting into this repository of data. And then, I had the luxury of working in the, quality side of things during my career. And it's sometimes the way we collect data isn't the way we need to abstract it, meaning like use of discrete fields or radio buttons or little things like this to ask, because from a quality perspective or from understanding the data in order to collect it more effectively or generate the more broader reports when you get granular into like some of these departmental level things like vascular access, the way we ask the question is almost as important as the information that we're collecting from it. So I'm really glad that you're coming on to talk about this because it's often these parts that are overlooked and people are like, oh, well, I mean, the data exists there. How do we get it out of the system? How do we make it meaningful information? And then, like you said, how do we turn that into change and how do we measure that in clinical outcomes? And big data is a huge thing. I think we're getting smarter, but I think we still have a long road to go.
yeah, and it's almost like how do we take it from the concept of big data and make it small,
Yeah.
right? Because especially as I'm still learning a lot in vascular access and trying to go absorb as much information as I can, but there's so much nuance. It's one thing to know that what our bloodstream infection rates are, or any given outcome, but it's another thing to understand, well, what's driving those things? What are the factors that are driving those outcomes, and then how do we ultimately shift? And if we're trying new things, whether it's products or process or protocols, can we track what those new things are doing and what impact they're having? Are they having an impact? And can we use that as a means to go expand um, what the solution is to make it more of a standard of care inside the institution? So I think there's a ton of information. I think I saw a stat one time that the average U.S. hospital consumes 780,000 iPhones worth of data. So if you think about how much a typical iPhone is, they consume it, and so much of that information just goes. It's stored for legal purposes, for billing purposes, but
Yeah.
it's not driving outcomes.
No, I appreciate the way
And
you quantified that.
that's
Well,
it's a that's a that's a, it's an interesting way of
yeah.
putting it, but we consume a ton of information, and the flip side of that is every single piece of information that we're consuming, for the most part, somebody's putting their hands on the keyboard. And if they're putting their hands on the keyboard, they're not interfacing with the patient, which it deters the whole experience, the caregiver experience and the patient experience. And so one of the things we think a lot about is not only what's the data that we can go get, but what's the workflow, especially for somebody in vascular access. They're mobile, they're moving throughout the hospital, and as I shadow them, these folks that are trying to place lines and care for the vascular access lines, they're constantly having to try and find a computer. I mean, the amount of time that's spent just to find a computer is a significant portion of time, which no value add to the patient whatsoever. And there's a lot of work that we can do just in that, right? And if you just think about that and how we could make that easier to have everything they need all in one spot, we could make the vascular access specialists so much more efficient and provide so much better care for their patients.
Exactly. Well, Andy, thanks so much for joining us on Facebook Live.
Yes.
please check us out, Ivy League Learning. I put a link in the description down below, so just make sure to click on that. Like I said, it's free to join. Wednesdays, I believe it's every other Wednesday at 7:30 p.m. Eastern Standard Time. So check out the full list of speakers, the different links to join. Make sure you register and get in on this really valuable information. And with that, I'll take us out from there. So, Andy, thanks again for joining us today
Thanks for
on
having me.
Facebook Live. It has been a pleasure. I love data, and I know there's a ton of us data nerds out there. So, with that, if you guys want to follow the Association for Vascular Access, you can check us out anywhere on social media. That's Facebook, Instagram, LinkedIn, Twitter. If you're a huge fan of YouTube like I am, you can check us out there as well. And with that, we'll catch you on the next one. Bye, guys.